Welcome back to the Pops podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we're diving into the invisible foundation of lifelong health, and that's the infant microbiome. We'll talk about how their gut gets seeded at labor and birth. We'll talk about how breastfeeding can support their ecosystem both inside and outside. We'll also talk about all that you can do to help, even if things don't go as planned at labor and birth or even immediately postpartum. What is the microbiome? So this is going to be helpful for just your own knowledge about yourself and really helpful for knowledge about your baby. The human microbiome is a vast ecosystem of microbes. It's bacteria, it's viruses, it's fungi, it's archaea. They live inside and outside of the body. These microorganisms are mostly found in your gut, but they're also found in our lungs, in our mouth, in our skin, and in our reproductive tract. So think of these as a living fingerprint, completely unique to each person, constantly interacting with the body. Every single person has their own microbiome and their own unique makeup of bacteria. It's not that you have very specific bacteria to you. That can be true, but just your collection of bacteria on your microbiome is going to be unique person to person. So what does the microbiome do? These microbes aren't just hanging out on our body or in our body. They're actually helping our body to thrive. They digest food, they produce vitamins like vitamin K, vitamin B12. They train the immune system and protect against harmful pathogens, which is sickness or illness or lack of health. It's dis-ease or disease in the body. Many of these microorganisms send messages and signals up to the brain through the gut-brain axis. We just talked about this a couple episodes ago, if not the last episode. These influence things like mood, focus, and sleep. I want that to really sit clear before we dive into everything else. This is why we're talking about this today, because your microbiome affects your mood, your focus, and your sleep. Three huge things that help us perceive the world, perceive life as it is. So what is the gut-brain axis and why does it matter for babies? The gut-brain axis is a two-way communication system between the digestive system and the brain. It connects the emotional and the cognitive centers of the enteric brain, which is our gut brain. It's the brain in the gut. The microbes in your gut actually produce neurotransmitters like GABA, dopamine, serotonin, and in fact, the gut produces 90% of the serotonin in your entire body. These are the same chemicals, the GABA, serotonin, dopamine. These are the same chemicals that are going to regulate our stress or focus, our sleep, and our mood. This means that gut health is directly related to our mental health or to our brain health. In adults, an imbalanced microbiome has been associated with anxiety, with depression, poor focus, even neurodevelopment conditions. In babies and in children, this connection is still forming. It's not set in stone when babies come into the world. It's still forming, it's still growing, it's still learning. So it's just as important. Early microbiome development may play a role in shaping emotional resilience, sleep rhythms, stress response, and even temperament. Supporting the baby's microbiome early may not just reduce allergies or digestive issues, but it can really support an emotional regulation system and a nervous system development as well. A baby is born almost kind of blank. At birth, a baby's microbiome is virtually underdeveloped and the gut is ready to be colonized. So those first microbes in the first few minutes, hours, days of baby's life are going to be the microbes that lay the foundation for baby's health and lifelong health. This is called microbial seeding, and it lays the foundation for digestion, immune function, and long-term health. And depending the generation of which you have knowledge from, there's conflicting research about sterility of the womb. For decades, it was believed that babies were born sterile and first exposed to microbes at delivery. Newer research shows that there might be some microbes in or may reach baby in utero via the placenta or the amniotic fluid. But birth is still considered the primary moment of microbial seeding. So we're going to focus on the birth aspect of microbial seeding. And we can talk about womb microbial seeding another time. So why this moment matters so much. It's birth, why baby coming out, seeding the gut is so important. The first bacteria that baby encounters helps teach the immune system what's normal and what's threatening. So the first wave of microbes that colonize the baby's gut educate the entire immune system and the immune cells. They act like tutors, showing the immune system what is supposed to be in the body and what's not supposed to be in the body. This process is called immune tolerance. This helps baby to learn how to tolerate normal things like food proteins, pollen, or friendly bacteria instead of overreacting to those things. What is considered normal and what is considered not normal. Friendly bacteria from vaginal flora, breast milk, skin-to-skin contact with caregivers, the home environment, even pets or older siblings. These all are really safe, nice environmental microbes that are going to help build your baby's gut. Everyday exposures like dust, dirt, natural outdoor microbes, diverse non-sterile surfaces, including solid foods much later on, also help build your baby's gut microbiome. Frequent exposures to these types of things help the immune system calm down and respond appropriately. What's considered a threat inside of the body is typically harmful bacteria like group B strep, E. coli, listeria, antibiotic-resistant strains picked up in hospital settings, super common, pathogens from unsanitary conditions, and overexposure to antibiotics early on can also strip the microbiome and confuse immune signaling up to the brain. So if the immune system isn't trained well early on, it may overreact to harmless things. You can think like eczema, food allergies, asthma, or it can underreact to real threats like chronic infections or just having poor gut resilience. So the gut contains something called GALT, gut-associated lymphoid tissue. This is packed with immune cells, including T cells and antigen-presenting cells, which act like bouncers at a club. They decide who's safe and who's not safe. And these cells will sample the microbes, kind of like food particles in the gut. So they'll take a little bite, they'll see how it does, and then they'll either allow that in or they will signal the team, hey, we have a pathogen, somebody who's not supposed to be in here. We need the immune system to kick them out. A well-seeded microbiome is associated with lower risks of allergies, asthma, eczema, obesity, autoimmune diseases, even anxiety and depression later in life. Now, as we step into birth, I realize there's multiple different types of birth. We'll go through some of the different ones that would affect this microbial seeding for your baby. We'll start with our most common, obvious one, a vaginal birth. During a vaginal birth, a baby is exposed to both mom's vaginal and gut flora, and these microbes coat the baby's skin, enter their mouth, enter their nose, and they begin colonizing the gut and the skin almost immediately. This is nature's starting kit. It's rich in beneficial bacteria like lactobacillus and bifidobacterium, which help digest milk and support immune function. So as your baby comes out, they are pressing through that vaginal canal. They are getting swiped with all of those microbes, and it's pushing up into their nose and down into their mouth while also coating all of the outside of their body. In cesarean births, in some if you remember it's been a long time now, when we talked about babies being born on caul inside of the bag where the water doesn't break, for babies that are born via C-section or sometimes born on caul, they sometimes miss this exposure to that vaginal canal microbiome. In a typical vaginal birth, baby is coated in mom's vaginal and gut flora during the descent through the vaginal canal. But babies born by C-section don't pass typically through that microbial-rich channel, and they're usually first exposed to skin and environmental microbes, especially from the hospital surfaces and or staff, because they are pulling baby out of you via surgery. Similarly, a baby born on caul, still inside the amniotic sac, may also miss or delay that first exposure if the sac is intact when baby is delivered, whether vaginally or surgically. They don't come in contact with that vaginal microbiome until the sac is ruptured. This can slightly delay or reduce the effectiveness of microbial seeding. These babies tend to be colonized with skin, air, environmental microbes first, just like C-section babies. And even though being born on caul is super rare and often seen as spiritual or symbolic event, it's still worth noting the microbial side. Antibiotics during labor can also change this handoff. So if mom receives antibiotics during labor, like the group strep or the group B strep, it reduces diversity of the microbes past the baby, even during a vaginal birth. These antibiotics don't just wipe out bad bacteria, but they also affect beneficial ones. This doesn't mean that antibiotics shouldn't be used. This doesn't mean that antibiotics are bad or shouldn't be used in specific scenarios or situations, but it does mean that baby may need some microbiome support afterward. Early interventions matter even after birth. So routine hospital practices like wiping down baby, immediate bathing, or limiting skin to skin can interfere with that microbial transfer. The more time baby has on mom's skin or another trusted caregiver, the more diverse and more healthy their microbiome can become. And we'll come back to vaginal seeding. I know some of you might be excited to get to that part. I will come back to it in just a second. Home birth versus hospital birth. Different microbial environments, right? Pretty obvious. Home birth, we're in our own natural environment with our own natural microbes. Hospital, very sterile. It's cleaned often, so there's not a ton of healthy bacteria living because a lot of times they get killed because we're cleaning lots of surfaces. Babies born at home are more often exposed to their familiar household microbes, those already present in their family's ecosystem. Hospital-born babies are more likely to be colonized by bacteria from sterile hospital environments and or staph skin flora, what's on the outside of other people's skin at the hospital. Neither is wrong, but it is helpful to understand the difference, especially when you're planning on some postpartum support. And again, like I've said before, no matter how you birth, whether you birth vaginally, via C-section, with antibiotics, without antibiotics, there's always ways to better support babies' microbiome and their ecosystem inside and outside of their body. The goal isn't to stress about what's already been done. It's to understand how the birth process shapes the first biological imprint and how we can continue to support it moving forward, even if we're not supporting their initial biological imprint. If you're like, oh my gosh, my baby was born via C-section and the environment was so sterile and they didn't have any, it's okay. It's okay. It's okay for what has already been done. If you needed antibiotics, if somebody accidentally wiped down your baby, let's turn our focus or stress away from what's already happened to what we can now do to continue helping support or change the foundation of your baby's microbial ecosystem inside and outside of their body. What about vaginal seeding? Let's get to it. We can create, or can we, I guess is a good question, can we create the microbial seeding that vaginally birthed babies get by doing vaginal seeding for babies who maybe don't get that vaginal seeding, whether they were born on caul, via C-section, whatever XYZ it might be. What is vaginal seeding? You may have heard of it. You may be interested in doing it. You may have never heard it before. Vaginal seeding is the practice of transferring a mother's vaginal flora to her baby after a C-section or an on-call birth. A piece of sterile gauze is inserted into the mother's vagina about an hour before delivery. After the birth, the gauze is used to gently wipe the baby's mouth, face, and body, mimicking the exposure they would have gotten during a vaginal birth. Now, I've seen this done and talked about it multiple different ways. The gauze is, yes, one way. You can also do sterile Q-tips, like swabs, or like you think about those long swabs that they do for like a strep test in your throat. You can use swabs like that too. The gauze is really great because when you actually go through the event of birthing a baby or a baby coming out of you, you are literally delivering your baby no matter how it's done. There are hormones, there are neurotransmitters, there are different functions happening in your body as soon as that baby comes out or as soon as the baby's about to come out. So as that's happening, all that vaginal flora that's being actively updated and created in the moment during birth, you want that to all be caught or captured onto the gauze. If you wipe before birth, you might not get all of those new hormones, new whatever it is that Q-tip for baby to have. The gauze really makes sure that you catch all of the birth process microbes. And so when you put that gauze over baby's face, they can theoretically experience some of that microbial seeding. Does it work? The question of the hour. Some early studies show promise that C-section babies who receive vaginal seeding had microbiomes more similar to vaginal born babies. One study in Nature Medicine in 2016 found that vaginally seeded C-section babies had increased levels of lactobacillus and other beneficial strains. However, more long-term research is needed. More current studies are small and short-term. So just like so many of the things that we're all interested in the world, they need more research, and we need to continue to support and ask for research like that. That really does help, especially moms who don't get the birth that they're wanting, or they're having a hard time processing the birth that they did have. It can be helpful to have these really nice support systems that are evidence-based, that are backed up by science, that help support moms who feel like they've missed out on certain aspects of pregnancy, labor, and birth. And this is one of those. The more research that we're able to get on this, the more we're able to help those moms who are looking for that vaginal seeding and maybe not getting an opportunity to do so with their babies. What are their concerns about vaginal seeding, and why are they always a big deal? The main concern with vaginal seeding is the potential of transferring harmful bacteria, especially if mom is positive for infections like group B strep, herpes, or certain STIs. Ideally, you have been screened for all of these. I think most hospitals require, and birth centers, I'm not super confident on that statement, but I'm pretty sure in the state of Colorado, most hospitals and birth centers require a vaginal screening to make sure that there is no harmful bacteria that baby would pass through. So you should know whether you have that harmful bacteria or not. If you don't know, ask for a screening. I don't know why they wouldn't offer you a screening to begin with. I think it's pretty standard nowadays. If it's not in your state, please let me know. I'd love to learn more. But if a mother has tested negative for all the infections, there's no complication or no complicating factors. Many experts argue that vaginal seeding may be a safe and natural way to restore what baby may have missed through the vaginal canal. So why the hesitation? Most hospitals work on protocols and standard procedures. They don't have any official protocol for vaginal seeding. ACOG doesn't endorse it yet because there's not enough long-term data. Providers may be concerned about liability. What I have experienced in hospital settings is providers saying, we don't do that here, and leaving the room. However, if you are at a hospital, at a birth center, or something, I'm guessing if you're at a birth center, you're not needing to experience this. If you're at a hospital and you're asking about vaginal seeding and they're saying, we don't do this, ideally you have a doula in the room or your partner, and you can say, can you go ask for some sterile gauze? Just because they don't have a protocol doesn't mean that you can't do it. Hospitals don't have a protocol for what outfit you put your baby in first, right? So when you put your baby in that first outfit, nobody's going to say anything. Same with vaginal seeding. You can put the gauze in. Also, if you're going to do this and you don't have support by the hospital or a doula, make sure that you know that you are tested negative for all of these things if you didn't get that before. As long as you know that you're negative, you can do it yourself. Ask your partner or your doula, hey, can you go ask for some sterile gauze? I want to do vaginal seeding. Put that sterile gauze in there and you're good to go. Guess what? They're not doing vaginal surgery down there, so you can put the gauze down there and you should be fine. Of course, there are extreme situations where somebody might find it, take it out. Who knows? It's worth a try. You can also do both ways. If you're worried that something might happen to the gauze, you can do the swipe with the Q-tips, and then you can also do the gauze. And then you guys can take care of the microbial seeding immediately afterwards, as soon as you get into that recovery room. Bottom line, vaginal seeding is not inherently unsafe. It's just not widely supported yet, even for moms who are medically cleared. If it's something that you want to do, it helps to advocate for it early, find a provider who's familiar with the practice, and create a plan for both you to feel good. But like I just said, if you can't find a practice or a practitioner that is like, yep, you can do vaginal seeding, we'll support it here, we'll actually help you do it. If you can't find that, it's okay. You can still do it yourself. Is vaginal seeding the only option to recreate that microbial seeding that most vaginally birthed babies get? Vaginal seeding can be a tool, but it's not the only way to support a baby's microbiome. Skin to skin, breastfeeding, probiotics, and delayed bathing all play a huge role, and they tend to carry much less controversy. So the takeaway from that, vaginal seeding may help restore what was missed during birth, but it's still experimental. If you're curious, talk to your provider, do your homework, and make sure it's a safe fit for your situation. Talk to your husband about it too before you actually go into labor, so he's not like, whoa, what are you doing? We want everybody to be on the same page, or at least everybody as close to you as we can on the same page. Okay, you guys, I'm super excited about this new sponsor because it's somebody I've actually been working with for a while now called The Final Punctuation. It's a female-owned, one-woman editing and proofreading service. Her name is Carrie, and she has completely changed how confident I feel putting my words into the world. She's helped me with everything from my brochures to my doula contracts to small marketing things. And not only is her turnaround time incredible, but she helps you to understand the why behind her edits. She sees things that I would have never caught and somehow keeps your voice intact while making everything stronger, cleaner, and clearer. She works with all kinds of creators, from bloggers, podcasters, to small business owners, marketing folks, and even students. Anyone putting their words out into the world. And if you've ever posted something and noticed a typo after, you know how it feels. One tiny error can totally kill that first impression. In fact, stats show that only one typo can increase bounce rates by up to 85%, and grammar mistakes turn away nearly 60% of readers. And I know what you're thinking about AI. Can it just take care of all my grammar mechanics? AI still struggles with tone, nuance, and accuracy, which is not a great combo if you're trying to earn trust. So if you're writing anything from podcasts to brochures, website copy, marketing materials, let Carrie take a look at it. Visit thefinalpunctuation.com to submit a request for any project and tell her that you're a Popped Podcast listener for 15% off your first order. That's thefinalpunctuation.com. Now let's get back to the episode. So we're going to move into breastfeeding and the microbiome, because breast milk is not just about calories. It really is microbial medicine. Breast milk is a baby's first prebiotic and probiotic. So breast milk isn't sterile. It actually has live bacteria that seed and support the baby's microbiome in their gut. Breast milk is also full of human milk oligosaccharides, or HMOs, a specialized complex sugar that babies can't digest, but good bacteria like bifidobacterium can digest it, and they actually love it. There's other major bacteria that our gut needs that love the human milk oligosaccharides, or the HMOs. So breast milk is literally feeding the good bacteria and helping them to grow so that they can push out the harmful microbes. Colostrum is going to get its own episode one day. It's my liquid gold episode, but it is also liquid gold for the gut flora. Colostrum, the thick yellowish milk that comes out first, typically 1 to 5 days after birth, is packed with antibodies, immune cells, and early microbial support. It helps line and seal the newborn's gut, protecting it while friendly bacteria begin to colonize. Even just a few days of colostrum can have a lasting impact on the immune function and the gut health of your baby. Mom's microbiome also affects baby's microbiome. The bacteria in breast milk reflect mom's gut and skin microbiome, what she eats, how stressed she is, whether she's on antibiotics, and so much more. This just means when you nourish yourself, you're also helping nourish your baby's inner ecosystem. This doesn't mean you have to be perfect, but it is a reminder that postpartum self-care isn't selfish. It really is foundational. It is feeding two ecosystems. It's feeding yours and your baby's. Taking care of your gut health, your mental health, and your overall well-being makes your body even more powerful as a source of support for your baby. And if you're not breastfeeding, it still applies. Babies need co-regulation contact, they need skin to skin, they need comfort, and you can't pour these out to your baby from an empty cup. So now when we have events during labor and birth where we feel like baby's microbiome or gut microbiome has been wiped or it didn't get all the seeding that it needed, How can we continue to support these babies? For babies born via C-section, on caul, or with some sort of antibiotic exposure, breastfeeding becomes even more important and even more impactful for them. It helps reintroduce and grow beneficial bacteria while reducing some of the disruptions from birth interventions, whatever may have happened. And then every latch after that is a dose of microbial support. Breastfeeding is not just feeding. It's a repetitive, living way to seed out and strengthen your baby's gut. Skin to skin, mouth exposure, and even back and forth saliva exchange between baby's mouth and breast all help support this process. Your breast milk was designed to feed both your baby and their bacteria. If you are able to breastfeed, it's one of the most powerful tools that you can use to shape your baby's microbiome. If you're not breastfeeding, there are still ways to support your baby's microbiome. And we'll cover those in the next section. But before we do, I want to clear this up too. Spit up doesn't always mean that your baby has a gut problem. I often hear this in the office. Out of all the different things that I see people experience with their babies, where I'm like, oh, that might be a gut issue. A lot of times when moms bring their babies in with repetitive spit up or fussy spit up, they're like, I swear my baby has a gut issue. They're spitting up all the time and they're fussy and they're irritated. There's something in their gut. Spit up is common, and in most cases, it's not a sign of a damaged or imbalanced gut. In many babies, especially newborns, it's simply because the esophageal sphincter isn't fully developed. The sphincter that allows the food that gets swallowed to stay in your stomach. That little muscle is supposed to help keep the milk down, but newborns, it's really floppy, so a lot of times the milk comes back up. Unless it's paired with another symptom like poor weight gain, mucousy or green stools, rashy skin, extreme discomfort, it's probably just spit up. Annoying? Yes. Dangerous? Usually not. Over-pathologizing spit up can lead to unnecessary supplements, restrictive diets, or just unnecessary worry. The best thing you can do to stay curious is observe your baby's full picture and not just jump to the gut-related conclusions right away. I know this whole episode is to bring awareness to gut issues. I just wanted to make it very clear that the one common connection to gut issues isn't always the right connection to gut issues, and it's often spit up. So I just wanted to make that clear in case you're thinking, oh my gosh, my baby's microbiome is not great. They spit up all the time. Let me clear the picture. Maybe that might be true, but more often than not, it's probably not a gut issue. So if it's a spit up issue, definitely go get it checked out. But what I'm talking about with the gut issues, the gut microbiome, a lot of times this doesn't lead to excessive spit up. So if that's something you're noticing in your baby, it's probably not a gut issue. It might be, but go get it checked out. So let's get into other ways to support your baby's microbiome, especially if they've missed very perfect birth scenarios that you were imagining to happen. You still have so many tools in the tool belt, and I want to go through them so that you feel locked and loaded, like you're ready to go in case baby needs some microbiome or gut support. So skin to skin isn't just for bonding, it really is bacterial gold. Your skin is covered with microbes unique to your environment, to your family, and when your baby lays on your chest, they pick up those beneficial skin bacteria, especially around the mouth, nose, and eyes where colonization starts. The more time spent skin to skin with parents and trusted caregivers, the better for microbial diversity. We also have delaying the first bath. Seriously take consideration into this one. The vernix, that creamy white coating on the outside of baby's skin once they've come out, is loaded with protective antimicrobial peptides and healthy fats. It also helps trap the beneficial bacteria from birth against baby's skin. So it'll actually encase that really awesome bacteria onto baby's skin so that it can stay, grow, colonize, and actually start building baby's own microbiome. Bathing your infant too soon often removes the vernix and those newly acquired bacteria or microbes. I always encourage parents, try to wait 24 hours. On the soft side, maybe like 12 hours, but I really think that 24 hours you can do it. It really helps allow baby to soak in all of that beneficial bacteria. And because babies were just inside of fluid for 10 months, a lot of times that vernix can really help keep some moisture into baby's skin as they start to transition into air. If you notice, a lot of babies look really peely and like they have lots of dry skin. It's just because their body's getting used to being in dry air and not constantly in amniotic fluid. The vernix can really help that skin make that transition from fluid life to earth life with air. Consider infant probiotics, especially after antibiotics. If a mom or baby receives antibiotics during labor or early infancy, probiotics may help replenish the gut with beneficial bacteria. Look for strains like B. infantitis, L. reuteri. I'm going to put these in the show notes. I know I said that last week and I forgot what it was, so I didn't put it in the show notes, but I'm going to put these in the show notes so that you can look for them. And L. rhamnosus, GG, which are commonly used in infant microbiome research. Always check with your provider, but especially consider this if your baby has signs of imbalance like eczema, gassiness, mucus in the stool, things that are starting to look like gut issues. Pets, siblings, and dirt. These are our diverse exposures to microbial life. Babies raised around dogs, older siblings, and natural outdoor environments are often exposed to much more diverse microbes, and more microbial diversity equals a stronger immune training. Letting baby crawl in grass, play in clean soil, or be around family pets safely, obviously, can actually really help build that more resilient gut. Stop over-sterilizing your house. A little hand washing is good, but excessive sanitizing of everything that baby touches or may lick or put their mouth on may do more harm than it does good. Your home's ecosystem, your floors, your furniture, your hands, it's already full of safe bacteria that your baby is meant to encounter. Sterility is for surgeries, not for babies learning about the world. Microbiome support isn't all or nothing. It's daily, it's simple, it's usually very powerful. Skin to skin, dirt, milk, pets, patients can do all of what small little expensive little bottles sometimes promise to do. Your baby truly experiences microbial diversity in the world, not through medicine, most commonly. Let baby experience the world with a little bit of guidance and a lot of trust in nature. But wait, what about babies born in water? Doesn't that sort of count as a bath or a first bath? Yes, kind of, but not really. So let's talk about it. In a water birth, baby is born directly into a tub of warm water, typically, usually in a home or a birth center setting. The water is clean, but not sterile, and baby is gently brought to the surface while still attached to the cord. While it may look like a bath, it's not quite the same as a scrub down. Baby isn't wiped or washed with soap, and the water is usually colonized with mom's own skin and vaginal flora, especially if she's been laboring in the tub for a while. With that said, some gentle rinsing does happen. They're born into water. Water's coming over them. Especially if the vernix or the fluids wash off in the process, it's just a more diluted version of microbial transfer, but it is still more natural than a hospital bath or sterile water and soap. Literally how we're cleaning babies at hospitals for their first baths. So to protect and support a baby's microbiome after a water birth, go straight to skin. Delay any additional rinsing or drying, and encourage breastfeeding and keep baby close to the birth parent. Keep the birth environment as low intervention as possible. If this is happening at a home or a birth center, there really shouldn't be a ton of intervention happening anyways. However, at certain birth centers, there is 30-minute marks for the placenta to be delivered, or certain standards and processes that they also need to follow and are required to by law. And so sometimes those small things do happen and do come up, but often it's much less chaotic and much less noisy in a birth center or a home setting. I want to list some of our key takeaways. I'm going to start trying to do this in some of these more sciencey or heady. So let's go through my 6 takeaways. One, your baby's gut is built from birth. The microbes that they're exposed to in the first hours or days of their life lay the groundwork for their digestion, immunity, and even emotional resilience. Two, vaginal birth seeds the gut with powerful bacteria. But if that's not how your story went, there's still so many ways to support your baby. Three, breast milk is a living medicine. It feeds both your baby and the good bacteria of their gut. If you're nursing, you're doing incredible microbiome work with every single feed. 4, microbial exposure isn't gross, it's growth. Skin to skin, delayed baths, messy pets, dirt under the nails is all part of the process. Let babies be babies. Let them get messy. Their immune systems, thank you. 5, you matter. What you eat, how you rest, how you care for yourself, it all contributes to the environment your baby is growing in. You're not just nourishing yourself or your baby, you are truly shaping their inner world. 6, it's never about doing it all right. Thank you so much for listening to this episode. I hope that it was helpful, especially for those mamas who are really interested in having that as an option or part of their birth plan if part of their Part B birth plan, if things don't go the way that they're supposed to go, or if you've already been planned for a C-section and you didn't want a C-section and now you're trying to decide how you're going to help support your baby and yourself through the C-section. This is just one small aspect of that support, but it's huge for your baby's entire life. We have kiddos that come into the office who have had gut problems since day one of life. So we're still trying to, help people with their guts, and they can be helped. But the more that we are aware of how we can support and protect gut lining, microbial seeding during labor and birth, the less we would see kids later on in life still experiencing gut issues, still experiencing skin rashes or mood disorders. All of this is going to affect your mood, stress, and sleep. All of this is going to affect your baby's mood, stress, and sleep. So if we can help support their gut for all the signals that are going to tell their body what mood they're in, how focused they're in, what stress they're experiencing, and how to sleep, we really need to look at this aspect. Even though it's a small piece of labor and birth, it's a huge aspect of our lives for the rest of our lives. Please share with another mama to be, your doula, your care provider, whoever you think might enjoy an episode like this. You can also share it with your partner if this is something that you guys want to do with a planned C-section or just in case it goes to a C-section. It's great to make the plan now and start prepping and just be aware of what you can do to help support everybody in the situation or process. I hope you guys have a great week. Please leave a like, comment, subscribe, write a review, whatever feels good to you. I'm Dr. Emily, and you've been listening to the Popped Podcast.